Hello. Hello, Dr. Miaken Zeigler of Zeigler Chiropractic. Welcome to tonight's workshop. We are going to dive into understanding cancer. And, 40, 50 years ago, if you asked somebody, do you know anybody who has cancer? Maybe a couple of people will say, yeah, I know somebody. You ask somebody now, and it's, I know a friend, I have a family member, I have a colleague. I know multiple people who have been diagnosed with cancer, who are going through cancer treatment, who have passed away from cancer. And so I think it is so vital to understand what is cancer. And that's where we're going to start tonight, with answering that question. So I'm going to go ahead and share my screen with you. And typically when we do this workshop in the office, this is really a time for us to have a conversation, really be in discussion with what is cancer? What does that mean if you have cancer? I want you to think about that for a second. We see this diagnosis all the time. We see breast cancer, we see non-Hodgkin lymphoma, we see osteosarcoma, we see liver cancer, prostate cancer, ovarian cancer, right? We see this diagnosis all the time, but what does it mean? Typically, when you have a cancer that's metastasized, that means metastasized has gone throughout the body, but they call it breast cancer. It's because it originally was found in the breast tissue and then later moved to other areas. But let's just talk about what is cancer. If we go to the base level of life within the body, it is, we look at their cells, the cell structure, and cancer is considered abnormal growth of cells. That's all it is. Cancer is abnormal growth of cells. They are no longer programmed to do healthy processes in the body. They are out of control, no longer doing what they're meant to do. They don't have a program that's called apoptosis, which is cell death. So they kind of go crazy, they go haywire, and they are doing their own thing, proliferating and growing, okay? Now, how long do you think it takes for cancer to become large enough for us to identify under a microscope? Because if you were diagnosed with breast cancer today, did you have it yesterday? 2 weeks ago? What scientists have found is that for breast cancer, it can take anywhere between 10 and 12 years before it's large enough for us to identify. So typically, by the time we have a cancer diagnosis, we're talking about an internal environment that is really unhealthy, and it's allowed for these abnormal cells to proliferate and grow and really take over. So let's go to this next box here. What words or emotions do you experience when you hear the word cancer? Right? Typically, it's pretty negative. I find that, especially when we're looking at our traditional healthcare system, an allopathic model, we tend to be pretty scared and fearful of this diagnosis. And so the thoughts are, get it out of my body, burn it out of my body, inject me with toxins to get rid of it. I hate my body. I'm scared of what's going on in my body. So it's certainly fear-driven. Maybe there's some shame, anger. A lot of negative emotions can be experienced with a cancer diagnosis. I think with fear being at the front end of that. Let's talk about that for a second. There's many directions we can go here. There is a Japanese researcher out there. His name is Emoto. He did something called the water experiments. And what he did was he labeled jars of water, under labels of love or peace or hate or anger. And then he froze that water and he looked at it under the microscope. And what did he find? Okay, I'm going to show you another screen here. See if we can find it. Share this. Let me see here. This is what he found. So I just searched under Google Emoto water experiment, and these are some of the things he came up with. So when you labeled the water with positive, loving, energetic words or statements, the water turned into these beautiful geometric patterns or snowflakes, very expressive. And when you looked at the more negative states, right? We look at this one, it says, you fool, or evil, or you make me sick. The water looks like it implodes on itself, looks like it is exploded, looks smeared, right? So you can see this, I think it's interesting. Polluted water before prayer, polluted water after prayer, right? So I bring this up because our body is made up of 60% water. That's according to the Journal of Biological Chemistry. And if you break that down, your brain and heart is 73% water, lungs 83%, skin 64%, muscles and kidneys 79%, bones about 31%. But your body in total is estimated to be about 60% of water. So if your emotions, when you experience cancer, shift to fear, anger, hate, and you direct those to yourself, and 60% of you is made up of water, how are you expressing health? How are you expressing vitality? How are you supporting an immune system? So getting your headspace and allowing for those emotions to take place, but then moving beyond that to allow your body to process and heal is so vital. Okay, next, what action steps are typically taken when given a cancer diagnosis, and how quickly are they acted upon? So there is a standard of care. You get a cancer diagnosis, and most of the time I find that people want it taken care of immediately. Get rid of it. What do I do? Right? Standard of care is radiation, chemo, surgery. But how important is it for you to act on it immediately? In most cases, if it's been around for years, maybe decades, depending on, the cancer, right? Is it, you think, valuable to consider, why is it there in the first place? What can I do, maybe, concomitantly of care and standard of treatment to support the health and internal state of my environment, right? Just a different way to look at cancer. So, and what is typically the outlook in terms of cancer, right? It's am I going to survive this, right? How many months, how many years do I have? So my question to you is, do you think this plays a role in your healing? And absolutely, of course it does. You talk to cancer survivors, you look at the research, and they say, when you are given a cancer diagnosis, the one thing that sets people apart in terms of if they will recover and survive versus if they will succumb is, do they have hope? Do they think there's something they can do about it, right? So if you feel empowered, if you feel motivated to make a change, then guess what? You're in a percentage of people that are more likely to survive and come through. So what is cancer? When you look at some of the specialists and doctors who are really in this industry, they say cancer is an abnormal growth of cells. They lose their apoptosis, their programmed cell death. They don't die, they become immortal. Here's another one. Cancer is a condition where the cells in the body are no longer responding to the signals that tell them when to quit. In other words, most cells have a purpose for developing. They develop to a certain point and then they stop. Cancer is a response to toxicity. Cancer cells feed off of toxic waste. The cancer tumor serves as a purpose. It is how the body tries to keep us alive when we are in danger of imminent poisoning. Only by addressing the cause, the toxic inflammatory situation that caused the body to create a tumor, can we expect a real cure? So let's sit with that one for a second. Cancer is a response to toxicity. Cancer is a response and an adaptation for us to survive. A very different lens in which we're viewing our body, right? Our body does nothing that it shouldn't. Every process, everything that happens is an intelligent response by our brain, by our bodies to adapt and respond to our environment, both internally and externally. So we have to ask again the question of, why is the cancer there in the first place? And what is the health of my internal environment that allows for these abnormal cells to proliferate and grow? Next, cancer is a process that occurs in our body all the time. As we're sitting and talking, there are cancer cells that are constantly created in the body. They do not always lead to the development of cancer because our immune system finds them as abnormal cells and eliminates them. Let's sit with that for a second, right? We have abnormal cell growth happening all the time. It's just when it becomes big enough that it's labeled as cancer, right? And if our immune system is healthy, it can take care of these abnormal cells. No big deal, no problem. But if we have an unhealthy internal environment and an immune system that can no longer respond to the stressors, then that leads our body susceptible for abnormal growth to proliferate, right? So cancer is a natural wound healing related process. However, if the cause of the wound or if the wound persists, the continuous wound healing process will lead to a clinical cancer mass. The logic of this cancer mechanism is consistent with the rationales of the other physiological metabolisms of the body for survival. Again, a different lens in which we're viewing cancer, right? Cancer is a part of us. It is not separate. So why is it there? So at any given time, we have 10,000 to 100,000 abnormal cells in our body. And once the abnormal cells have surpassed a certain number, then you are diagnosed with cancer. But our immune system's job is to get rid of those cells. If your immune system is perfect, if you don't have a virus that it's already fighting, if you don't have too many chemicals or other things going on in the body, then it grows and it grows and it grows. Okay? So we need to ask a different question. What's going on with the health of the internal environment that allows for cancer growth to really get out of control in a period of time, in a length of time for years, that it becomes a cancer diagnosis? That's the question we need to be asking. So here's the next question. Again, these are opportunities for you to really dig in here and think about, well, why would there be abnormal cell growth? What allows it to flourish? What creates a toxic internal environment? Okay, let's start there. So I want you to think about this. Why would you have an unhealthy internal environment? Okay, I was just doing some jotting down earlier today as I was brainstorming, what would create an abnormal, internal environment. These are things that I came up with. Well, infections, right? We could have bacterial infections, viral infections, fungal infections, parasites. We could have mold. Okay, those are a category of things that could stress our immune system, cause an unhealthy internal environment, and take our immune system away from doing what it's meant to do. What else? Let's look at our lifestyle here. Processed foods, ultra processed foods. Did you realize that's a thing? There's processed foods and then ultra processed foods. Did you realize that ketchup is considered a vegetable at this point? Yeah, ketchup is not a vegetable. Number one, tomatoes aren't even a vegetable. But number two, the first ingredient in ketchup is high fructose corn syrup. So that gives you an idea of, where our world and headspace is around food, nutrition, right? Sugar, I said high fructose corn syrup. Let's talk about how our foods are grown. So you use of pesticides, herbicides, fungicides. We've got dyes, we've got coloring, we irradiate our food to preserve it for long periods of time, right? A lot of our food is coming from California. coming from not necessarily within 50 miles of where we live. So we've got to make sure that food can preserve for long periods of time, right? Was the orange picked yesterday or was it picked 2 weeks ago? You know, by the time, well, they've done this study, they've taken the blood of a baby at birth, and they found that there's over 200 toxins in, you know, the baby's blood already through the placenta from the mom, right? We've got, you know, we can talk about household chemicals that we use in terms of cleaning our home, what we use in our detergents, perfumes and fragrances. We've got makeup and things that we put on our body, lotions that are made of chemicals that can disrupt the balance of the health of our bodies, that can disrupt the microbiome, which is so vital and important for the health and well-being of our bodies, right? So what are the abnormal cells allowed to flourish? Alexa, welcome. You're welcome to join in at any point, because we are just talking about cancer being abnormal cell growth in the body and when it's allowed to proliferate. So what creates those toxic internal environments? Other things, electromagnetic fields. You know, everyone has a cell phone. Okay, we used to just have lights, we had computers, we have wireless. Now we've got towers, cell phone towers. Now 5G is really coming on strong. The towers are shorter, so they're closer to our height. So electromagnetic fields, you know, people will make fun of this, but if you look at the research and the data, it shows that stresses the body systems. Emotional trauma, right? If we've experienced any past emotional trauma, some people will look at cancer if through treatment you don't address any of those past emotional traumas, it will be challenging for you to move through and allow your body to recover and heal. So we've got, let's see. Anyway, I just listed a ton of things that could impact your immune system's ability to keep that abnormal cell growth within, you know, the 10,000 to 100,000 limit and allow that to proliferate. So there's many, many, many more. We can talk about stress related to work or finances. Look at the last year and a half of going through COVID in 2020, right? Not just being exposed to the coronavirus, but being exposed to and being scared to be around other people. We are humans meant to be in contact and connection, right? If we have lack of community and we are isolated, that has been shown to be the worst stress that we could ever experience compared to anything else in terms of our health. So there are many things out there that we don't even think about that our body is adapting and responding to, and our immune system is taking care of. But if you have stress, and those stresses are, you know, building over time, that can impact our immune system's ability to regulate appropriately. So let's look at this. So what are the causes of cancer? Okay, I've got 6 minutes left, so I've got to make sure we're done here. So 18% of cancer is caused by infection. That's those bacteria, virus, fungi, mold. 23% of cancer is related to obesity. This is back in 2015. 75% of the US were overweight. 41% is obese. That's a big number. 41% of cancer is caused by environmental factors. Okay? So if we're just looking at the percentages right away, 18, 23, 41, I mean, we're getting up there to a pretty significant number of cancers being related to lifestyle choices and factors and what we're exposed to. Because 18% of cancer is unknown. It could be genetics, it could be the ambient environmental radiation, but really that is a percentage of unknown cancers. So over 75% of our cancers are related to our lifestyle choices, which is a big number. And how do you think our healthcare system is doing right now? Not so good. Cancer is a $1 billion industry, right? And it's expensive. So we got to make some changes here. But let's just talk about cancer treatment. Oncologists will never ask, what caused this? Let's get rid of the cause. No, they're looking at what is the intent and purpose of treatment? It is to kill the cancer cells. And the way that they measure success and effectiveness of their treatment is, does the tumor shrink? Okay. They are not looking at successive treatment as, does this mean the patient lives longer or has an improved quality of life, right? Their purpose is to shrink the tumor. Okay. So I found this to be an couple interesting points here. Standard of care, chemotherapy, radiation, surgery. One of the most comprehensive investigations on the effectiveness of chemo was performed by cancer research Ulrich Abel. He contacted 350 medical centers and reviewed thousands of papers from biomedical journals to gauge the effectiveness of chemotherapy in cancer patients. He reported that the success rate of chemo was appalling and found no proof that chemotherapy can extend in any appreciable way the lives of patients suffering from the most common organic cancers. Further, in a study of every randomized controlled clinical trial between 1990 and 2004, the 5-year survival rate for the most common forms of cancer was 0 or close to 0. That's pretty terrible, right? So let's go back to, what are the causes of cancer? If over 75% of the causes of cancer are lifestyle related, our environmental factors, our infection is an immune system that is suppressed, that is not able to manage appropriately the abnormal growth of cells, then we need to start there, right? We need to look at the lifestyle pieces and how people are choosing to live, how they're feeding their body, where their headspace is, how they're connected to people, right? We don't need to look at, let's treat and get rid of the cancer, because if we just pull it out, right? If we just remove it, it doesn't change the internal environment. So the essentials to creating a healthy internal environment, let food be thy medicine, right? I've got this really fascinating book. It's called Regenerate. It's got some really amazing details on cancer. And he talks about how our traditional treatments are about 20 to 30 years behind the research and what research is showing. So he talked about, I won't go into detail, but some breast cancers that he actually showed in this book were actually benign breast cancers, but we've been treating it as malignant breast cancer. And that trauma alone has impacted the mortality of thousands of women, right? So understand our treatment is behind on the research. But I bring this up because Sayer G here really truly believes that cancer is a result of poor eating and inappropriate detoxification. It is really a representation of not getting the appropriate nutrition and balance in terms of the foods you're eating and allowing the body to detoxify, right? Other things, balance your energy. So really looking at what salutogenesis is the opposite of an allopathic model, which is our current healthcare system. But salutogenesis looks at what is the birth of health and how do we keep and support somebody being healthy. And that is all of these things I've listed: chiropractic, acupuncture, exercise, sleep, life coaching, massage therapy, hydration, movement, balanced hormones, Reiki, mindfulness, meditation, Ayurvedic medicine, right? All of these things will balance your energy and bring health and vitality to a body, right? Healing emotional wounds, healing your thoughts and outlook on life. The mouth can play a big role in overall health. So looking at biological dentistry. You can get into specific herbs, supplements, vitamins, and you know, when we look at how can you really be proactive and do some preventative, you know, diagnostics, there is thermography, right? If you've got a proliferation of cells taking place, those create a lot of heat. So if you use thermography, it can actually tell us if there are higher levels of heat in a body that would maybe indicate something's going on there. There are specific blood tests that will help you gauge, is there an increased level of abnormal cell growth happening, you know, before that normal cell growth, and it gets up to here where you have, you know, cancer. We can gauge and see with certain blood tests, are you in this range? And if you're in this range, guess what? You need to consider, you know, changing some of the lifestyle pieces. So there are a lot of things I did not go over. This discussion can take place, you know, in detail. And let me see if I can change this here. In detail, and there's so many facets that we can cover. But I share this because, number one, what we're doing now is not working, right? And if you approach any chronic disease, but if you approach cancer with a different lens, curiosity, right? Versus judgment, jumping to conclusions, jumping to a treatment, get rid of it. If you approach it with a different lens and look at, what is my body telling me? Why is it here? What can I do differently? Yes, I can listen to my doctors about the appropriate treatment that they recommend, but it didn't happen yesterday. It happened over a lifetime. And what can I start to do now to heal my internal environment? What can I do to heal myself from within? And there's multiple facets that you can do to start that. Because you're not your diagnosis, right? You do not need to fit in a box. There are people who've come back from terminal cancer, people who've been given stage 4 pancreatic cancer, and they have healed. I'm not saying that's everybody, but I'm saying that there's a different way. And so that's where I love to be in connection with community. One of my purposes, I find meaning in connecting with individuals in a very authentic and loving way to support a different lens and a perspective on their bodies and what they believe health to be. And I tell you, people are hungry for that connection. They are desiring something different. And that's what chiropractic is we offer something different. And so I want to invite you to share what you know with the people that you love, right? When you are supported, when people who are making healthy choices, those people are closest to you, it supports the choices you're making. And the more consistently you do that over years and decades, it changes the trajectory of your life. And that's what I do. That's why I do what I do. You know, I've got Amanda here who has a very personal story about losing a father to cancer and going through that experience. And she's not the only one, right? My husband lost his father to cancer. And if we would have known what we know now, we would have approached things differently. So my goal is for you to get this information now so that if it happens next year, 20 years, whatever it may be, you have a different lens and there's things that you can do. And hopefully you're doing them now so that 20 years from now, things look a little different. So I appreciate you. Thank you for being here. And I look forward to hearing your takeaway when you're in the office next. But I am Dr. Miaken Zeigler of Zeigler Chiropractic. And I will see you next time.